Welcome to the podcast where we discuss health, health span, lifespan, and longevity. I'm Dr. Noor Gajraj. Welcome to the podcast. My name is Dr. Noor Gajraj. Today, let's talk about platelet-rich plasma or PRP injections. I'm going to show you a live demonstration in a couple of minutes, but first of all, let's discuss what these injections actually are. Platelet-rich plasma, or PRP, is a concentration of platelets in blood plasma. Platelets are blood cells that contain growth factors and other proteins that promote healing. Plasma is the liquid component of blood. How PRP is prepared. First of all, the blood is drawn. A small amount of blood is drawn from the patient. The blood sample is placed in a centrifuge, a machine that spins at high speed. The process separates the blood components, concentrating the platelets in the plasma. PRP collection. The concentrated PRP is collected and prepared for injection. How do PRP injections work? When PRP is injected into an injured area, the high concentration of growth factors released by the platelets can stimulate the healing process. These growth factors can reduce inflammation, promote tissue regeneration, and stimulate cell growth and repair. Common uses of PRP injections. PRP injections are used in various medical fields, including orthopedics for conditions like osteoarthritis, tendon injuries, ligament injuries, and muscle injuries. Sports medicine to aid in the healing of sports-related injuries. Dermatology for treatments like hair loss and skin rejuvenation. Wound healing to promote the healing of chronic wounds. So let's go over and let me show you how the injections are actually done. So this afternoon we're going to do a PRP injection. Now the first thing to do is to draw some blood, so I'm going to do that. How did you find that last injection, Betsy?
Oh, after 3 or 4 days, it worked. I bet 90% of the pain was pretty much gone.
Scratch.
And it worked literally about 4 weeks, and then it started to kind of lay off, and I knew I needed another injection. But man, yeah, I was so happy with it.
Good. And you can see I'm taking the blood here. We're going to get 2 bottles. It's very simple to do. That's one. And then I'm going to do another one. So I've got these 2 tubes of blood now. I'm going to put them in the centrifuge and lock it. And then we are going to spin it at very high speeds, and it's going to push the red blood cells down, and we're going to have the platelet-rich plasma at the top. So now we're going to remove these tubes, and you will see that the plasma-rich protein is at the top and the red blood cells are at the bottom. I have 2 of these. I'm going to put that plasma-rich protein into a syringe, and we're going to go and do the injection. So now I've got about 8 cc's of plasma-rich protein in this syringe. I'm going to place a needle into the knee joint first. It's all been cleaned. Put it in very carefully here. So I've got this needle in the joint space. Here is my platelet-rich plasma. I'm just going to simply inject through that needle, going in very easily, which shows it's in the right space. Usually just a pressure sensation. Going in very well. And that's it. Very easy, very safe, and very effective.